Hi, my name is Roxanne, and today I'll be educating a patient doing like a chemo and radiation therapy. I'll be discussing two medications and PO, which is by mouth, and IV. I'll be giving the side effects. I'll be talking about immunosuppressants. So, what is radiation and chemotherapy? Radiation has the longest, most concerning long term side effect. When deciding which to use, the decision is always about which will leave the patient healthier or more healthy. So, how do you manage the side effects of radiation? It depends on the amount and what the body can maintain. So, different patient has like different reaction because of their body type. But you generally see patients being tired, fatigue, skin irritation, difficulty swallowing. They're sensitive to cold and chill. Their taste in food, it tastes different to them. It would also damage their cells, but they have more impact with the cells that are dividing faster. So in your mouth and in your head or your scalp, those cells divide even faster. So when they do chemotherapy and radiation, you find that they will have sores around their mouth or they'll lose their hair very quickly. So this is what happened while they're taking chemotherapy or radiation. They tend anywhere else, so they get sores and hair loss. So some side effects will occur when you just start radiation. For other people, they have several doses before they start seeing any of this side effect. The two primary side effects, those are fatigue and skin irritation. Patients mainly complain about those two side effects. Skin reaction occurs simply because it's the first barrier it goes through. Skin becomes dry and itchy. So remember, when you're doing radiation, you go under this machine, and first thing it goes through is your skin. Remember, the skin is the largest organ of the body. So first thing they see, and so this is why they tend to have skin irritation. Um, they get red blisters, sores. So they have to be gently on the skin. When they bathe or take a shower, they have to pat dry. Don't scrub your skin because your skin is already as irritated as it is. You don't want to make it cause more harm to the skin. In terms of fatigue, try to stay active as much as you can. It might be hard, but however, like do with like 30 minutes walk per day, or even if you can't, like just do like a 10 minutes walk around the house. um you can modify your diet, because at this point in time, your appetite, you lose your appetite. And it is for this reason, like people going undergoing chemotherapy and radiation, they tend to lose weight. However, this is probably not the best time to lose weight, because then you have a loss in muscle mass, and then this make your body susceptible to get sick. And that's what we're trying to prevent. We're trying to eliminate the chances of you getting even more sick than you came in. So you'd have to modify your diet to suit the therapy. um if the patient realizes that he or she is unable to eat hot food, what they can try is cold food or liquid beverages, a smoothie or a milkshake. Now, we're not saying that this will give you enough nutrients like solid foods, but at least the body is taking in something to keep it going. So I'll be going through two medications. One is IV and one is oral. So the first medication is doxorubicin. It's anti-tumor antibiotics, and it is used for solid tumors. Its mode of action is to bind the DNA and inhibits the DNA and the RNA. The side effect of this drug is GI upset, alopecia, bone marrow suppression, which includes symptoms of anemia, neutropenia, cardiac toxicity, red discoloration, urine, and sweat. So, of course, when patients are taking this medication, you have to keep monitoring them, especially for cardiac output, because it causes cardiac toxicity. You don't want them to be, the cardiac system to be suppressed. Then you're gonna do a CBC because they're gonna have bone marrow suppression, and you can administer the risk. You can administer anti-medics for the nausea and vomiting, and they are at risk of developing infection because of the neutropenia. So you have to monitor these patients carefully when they're on this medication. Medication is vincristine. This stops cell division during mitosis in the M phase. The side effects are peripheral neuropathy, phlebitis at the IV site, and GI upset and alopecia. So as you can see that for both medication, alopecia is a side effect. But like I said before, they tend to have sores around the mouth and loss of hair because those cells grow faster. Key points is antiemetics for you're gonna prescribe antiemetics for nausea and vomiting again. Monitor for signs of neuropathy, because when the patient has neuropathy, they have needles. It's almost like a needle sticking them in the fingers and toes. So monitor them for the pain and if they complain of neuropathy, needles sticking them in the fingers and toes, then that's a sign of neuropathy. You can use central line infusion because of the risk of phlebitis. Irritating on the peripheral line IV or the peripheral IV, so you'd want to use a PICC line or a central line to administer the medication, and this is to prevent phlebitis at the IV site. Okay, so this is just a video giving information or educating patients who are taking chemotherapy or radiation. I hope this helps. Thank you.